Okay, good morning, good afternoon, good evening po sa lahat. Saan man po kayong panig ng mundo naroon. Welcome po to our 180th pala, 180 episode of our webinar series. So thank you for being part of our credible online community, and to all those who've just discovered us for today, maraming salamat po. And this is really I think it's our second webinar po, no, under the rebranded format natin. So for today, we'll be discussing something very dear to my heart, and just part of what we have been putting out there in the publicity materials, just showing that we are in an era where global population is rapidly aging. Therefore, there's an urgent need to prioritize research on healthy aging to ensure the well-being of our older citizens. And for today, we'll be shedding light on the crucial role of programs that foster a healthier and more active aging process, and delving into the importance of community health workers and volunteers. Mahalaga po sila in promoting and sustaining healthy aging initiatives, and exploring their roles in disseminating information, providing support, creating environments that foster physical, mental, and social well-being. I'm Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday. Also, my pleasure and honor to host this program. And with me today is the the coordinator for training, Dr. Dion Sakdalan.
Hello, good afternoon, Dr. Raymond, and good afternoon to everyone here in the Zoom, and to all our panelists, and to TVUP. Welcome po again to our weekly Fridays in this Zoom webinar, and to all those watching via live streaming on the TVUP YouTube channel, as well as on the UP System Facebook page, TVUP Facebook page, and of course, all those watching from TVUP Signal TV channel 101. We also welcome and thank our panelists, Dr. Shelly De La Vega and Dr. Mark Evans Abat, and we look forward to your talks later on. So, pag-paumanhin niyo po na ako ulit ang co-host ni Dr. Raymond, since Dr. Susie is quite busy now with her transition with her new position in the World Health Organization Regional Office as Director for Program Management in the Western Pacific. So, as you have seen in our opening billboards, our program is now called Health Updates. We have done a little tweaking of our program, but we are maintaining the same high-quality presentations and discussions, and then leveling it up to take a closer look at existing and emerging health problems in the Philippines and for the rest of the world. So for 2024 po, we want to go straight into the heart of the discussion. So we also compress it a bit, and it's a little shorter. But before we go to the presentation, we will probably have Dr. Raymond introduce our person on the street video.
Thank you, Dr. Dion. So far, for person on the street po, no, we try to get the pulse of the common folks on the street just to determine kung ano po yung baseline po na alam po nila tungkol sa webinar topic. And for today, the questions that we pose are as follows. So, ano po ang ibig sabihin para sa inyo ng healthy aging? Meron ba kayong alam na mga institusyon o mga programa para sa healthy aging? At nakakapag-konsulta po ba kayo or makikakilala kayo nagpapakonsulta sa mga espesyalista sa geriatric medicine? Please watch this.
Sa aking pananaw lang, habang pag tumatanda, kailangan magbago na tayo ng lifestyle.
Aging para sa akin is when you don't look at aging as a bad thing.
Living the wholesome life, kumakain ng mga tamang pagkain, especially mga vegetables and nutritious food.
Okay.
Para sa akin, healthy aging goes beyond the physiological aspect and also the psychological aspects on how elderlies go on with their lives. So, beyond mental checks, dapat inaasikaso din yung mental being nila and yung pinakang lifestyle nila on their everyday lives.
So when you're aging, you surround yourself with the young people and keep on having hobbies, keep your mental health okay, keep your mind working, keep your body working. Because in that sense, as you grow old, it's like a term they say, you're gonna age like fine wine. You won't seem like you're aging if you don't think you're aging.
Well, at least wala kang sickness, wala. Growing old, healthy.
Sa ngayon, wala akong alam. Maliban na lamang yung nababasa mo sa mga YouTube, sa mga Googles,
Di ko alam kung programa talaga siya, but some malls near us and even sa Circle, sometimes they have dance classes, ballroom and Zumba classes. Tapos, most of the attendees there, parang more focused talaga siya sa mga elderly. So, it's really like focused and yung purpose talaga niya, the intention there is for healthy living, healthy aging, so that they're being entertained and they're, like what I said, they're mentally happy, emotionally happy, and physically healthy as well.
Aware ako na merong government office na nag-serve sa senior citizens. But wala akong alam na program na total.
Currently, wala. Wala. Pero I've seen promotions about it, lalo na sa malls and yung mga exhibits for supplements, and yeah, those are the things I'm exposed to.
Kami mag-asawa, madalas kami nagpapakonsulta sa health service dahil nga mayroon kaming member ng media, diabetes. Ayan, madalas kami dyan, every 3 months nagpapa-lab kami, minamonitor namin ang aming mga kung ano yung blood sugar, creatinine, kung ano yung mga usually na ginagawa sa laboratory.
I have a few actually because I have a lot of grandparents. However, some of them already passed away, unfortunately. But before they did pass away, they did have a healthy life. And di ganun ka naging sobrang serious yung diseases nila, because they, like what I said, as much as possible, they took their maintenance well, ate healthy, and kept hobbies, and they didn't really think of aging as well.
Well, yun, pagsunod sa kung ano mga healthy food na dapat kong kainin, at saka pag-iwas sa mga hindi dapat kainin, like in my case, no, yung mga fatty foods, saka mga sweet, mga ganyan, no.
I have a friend who's a doctor, ganon lang, tsaka dyan sa health service. What I'm looking for is sana the government should sponsor a comprehensive health program for aging population.
Okay, thank you so much, TVUP. Just really an eye-opener po, no? Something that supports and strengthens po what we already have heard, but very, very, well, I guess a little bit surprising for me na meron pong mga elderly who are a bit more engaged, if you will, sa kanilang health. May mga napapalabs very regularly, nagbinabantayan po ang kanilang kasulusugan. So yun po, napakahalaga po noon. Before we go into our webinar proper po, no, we just wanted to make sure that all of those who have received their certificates of attendance, they have received those. At certificates of attendance po will be given to those who have watched at least 50% of the webinar duration. We have already answered a lot of the questions that you have. And if you have questions, especially if you feel you should have received a certificate but did not, please email us at stopcoviddeaths@up.edu.ph. For our webinar today, we'll be having our standard panel discussion format. And after our speakers have presented, that will be followed by a Q&A session. So let's not take any longer po. No? We'll get our webinar underway, and Dr. Dion will introduce our main speaker for today's webinar.
Okay, thank you, Dr. Raymond. So we are very fortunate to have our director of the Institute on Aging of the National Institutes of Health of the University of the Philippines, Manila. She will talk to us about promoting active and healthy aging. Ano ba ang tungkulin natin? And sana matouch din ni Doktora kung ano ang tungkulin ng gobyerno sa ating mga tao, no, in terms of promoting healthy aging. So please welcome Dr. Shelly Ann De La Vega. Good afternoon, ma'am.
Good afternoon to everyone. Good noon. Time for lunch, but I'm sure you are eager to hear about what is the best way to become healthier as we age. Kaya nga nang sabi natin, everyone is aging. So let me start our talk by preparing the slides now. Ito ba ay malinaw na sa inyo? Nakikita na
Yes, ma'am. It looks good. Go ahead po.
So Maraming salamat ulit sa TVUP sa ating pag-anyaya tungkol dito sa active and healthy aging. Pero ang importanteng tanungin, ano ba ang tungkulin natin? Ano ba ang nangyayari na ngayon? Siyempre, hindi ko naman po nalalaman ang nangyayari sa lahat ng lugar dito sa Pilipinas. Kaya napaka-importante na ang ating participants ay mag-share ng kanilang mga karanasan sa kanilang barangay, munisipyo, sa lugar na kung saan sila nagtatrabaho. So, ito po ang ating magiging objectives. First, we will define healthy aging, and then we will go through the challenges to healthy aging. We now are in the decade of healthy aging, and actually there is a global action plan, no? Led by the World Health Organization. And of course, there are already local responses. So ano bang ginagawa natin sa larangan ng Department of Health, sa Institute on Aging ng UP? Maya-maya, nandyan si Dr. Mark Abat sapagkat siya ay member ng Board of the Philippine College of Geriatric Medicine, yung mga specialista natin sa geriatrics. Yung ating iba't ibang mga roles sa ating komunidad. Okay? So, what is healthy aging? So, it is defined as a process of developing and maintaining the functional ability that enables well-being in old age. So, napaka-importante ng mga terminology na to. Yung functional ability, hindi lang yan yung pwede kang maglakad, nang wala kang wheelchair, nang wala kang tungkod, no? Pero yung magawa mo ang mga bagay na mahalaga sa iyo. Kahit ano pa man ang lakas ng katawan mo. Yun ang ibig sabihin ng functional ability dito. At well-being, alam naman natin ang well-being, hindi lang naman yan lakas ng katawan, hindi ba? Kagandahan ng kalidad ng buhay na sa larangan ng pagkakaalam natin, ang well-being or quality of life are related. Napaka-importante dito yung social environment, yung social support. So, ang perspektibo po ng healthy aging is life course. Sapagkat nasa sinapupunan pa tayo ng ating mga ina, ay nag-aging na tayo, hindi ba? So, and as we age, no? When we get born as children, as young adults, and older adults, we accumulate strengths. Hindi lang kahinaan, pero strengths. Pero sa pagka sobrang nagkakasakit na tayo, syempre meron na tayong mga deficits na ating naiipon sa ating experience. Now, very important is the role of the environment or what is outside of our intrinsic capacity. Yung intrinsic capacity po natin ay partly genetics, partly yung minana natin, no? Pero 30% lang naman daw talaga ang genetics eh. Ang nakakaapekto ng paano natin i-express ang mga namana nating genes, kunyari may namana kayong genes na mahaba ang buhay or namana na genes na may mga cancer, maaring mag-iba po ito eh, depende sa ating mga health and personal characteristics. Kanina sa Man on the Street, ang daming nagbanggit ng mga healthy lifestyle, di ba? So kasama po ito yung healthy lifestyle, health-related behaviors, traits and skills. Ang ating mga naging sakit, hindi lang sa katawan, kundi sa emosyonal na sakit, mga injury, kung naging disaster or accident ang ating mga naging kapansanan, no? Pero beyond that, para tayo ay makapag-function ng mabuti at magkaroon tayo ng healthy aging, dapat meron tayong healthy and supportive environment. Yun po ang importante dito sa ating framework on healthy aging. Alright, so ito naman ang pagkakaintindi natin, yung sinasabi nating life course, sapagkat tayo ay nung bata pa, napakalakas ng ating functioning. Pero tumatanda po tayo, nagkakaroon tayo ng intrinsic biological aging at ito po yung pulang linya, talaga pong bumababa yan habang tumatanda tayo. Kaya lang, kapag ang ating environment ay napaka-supportive, dito po tayo sa blue line, na maaring ang ating function kahit tayo ay may edad na, ay maganda pa rin. No? Yun po ang ating pag-uusapan ngayon. So ang vision po, ng healthy aging ng World Health Organization sa kanilang World Report on Aging 2015 is a world in which everyone can live a long and healthy life. So yun po. So how are we now responding to the challenges? Dito po natin sasagutin ano ba ang mga nangyayari at kung ano pa ba ang dapat mangyari ang ating mga tungkulin na dapat nating gampanan. Okay? All right. How do we respond to the challenges? So, meron po tayong global strategic plan, no, for the decade of healthy aging 2020 to 2030. Nag-uusap na po ang lahat ng mga countries, no, tungkol dito sa kanilang mga plan at kasama po dyan ang Pilipinas. Ang sabi po dito ay kasama po sa strategic objectives natin ay dapat meron tayong commitment to action on healthy aging in every country, developing age-friendly environments, aligning health systems to the needs of older populations, developing sustainable and equitable systems for providing long-term care, or ito po yung home care and institutional care or nursing home, and improving measurement, monitoring, and research on healthy aging. Now, dahil po ako po ay nasa Institute on Aging sa NIH, we will concentrate more on the research aspects and what we understand now, no, as to what is happening to our health systems for older people, to the age-friendly environments, and how we are improving measurement, monitoring, and research on healthy aging. So nandito na po tayo sa una nating important na strategic objective ay yung aligning health systems to the needs of older populations. Align ba tayo? May nagtanong kanina di ba? Ano ba ang gagampanan ng gobyerno? Siyempre, ang DOH naman po ay hindi magpapahuli sapagkat matagal na po tayong nakikipag-usap sa DOH, no? Kaming mga specialista sa geriatrics, ganun din yung mga ibang mga sektor ng gobyerno at ng mga academic at saka mga professionals, no? Mga nurse, mga rehab, DSWD, kasama din dyan. So, meron na po tayong sinasabi na DOH 2017 AO Services through Life Stages Approach, at saka sinama na din po doon yung epidemic and disaster response na natutunghayan po natin ang mga paano natin tutulungan ng ating mga tumatanda, no? At kamakailan lang dahil nag-universal healthcare na po tayo, 'di ba? Meron na po tayong magiging rollout sa universal healthcare. Napag-usapan na rin po kung ano ba yung primary care bundle for those age 60 and older. At nung isang linggo lang, nirelease na po ng DOH yung Omnibus Health Guidelines, kasama po doon ang older people. No? Ano ba yung mga dapat isama sa physical exam, yung mga laboratory, ano ba yung dapat mga ating lifestyle advice. Yun po ang kasama sa Omnibus Health Guidelines. Pero ang pinaka-importante dito sa universal healthcare, na may emphasis po tayo sa disease prevention, di ba? Tsaka screening, early screening for diseases including cancer, including memory problems, disabilities, etc. Okay. So, meron na po naman tayong health system. Maya-maya po, bibigyan ko po kayo ng mga example ng mga research namin na ginawa naming policy recommendations para sa DOH at iba't ibang sektor ng gobyerno. Okay, ano ba itong developing age-friendly environment? So, hindi naman po kasi natin kaya na tayo lang, hindi ba? Yung ating pagtanda, talagang manghihina tayo kung hindi tayo suportado ng mga taong nagmamahal sa atin, yung ang mga nagbibigay ng mga serbisyo para sa ating kalusugan, pati na rin sa transportasyon, di ba? Sa ating edukasyon, sa ating protection against violence and against elder abuse. Lahat po yan ay napaka-importante sa ating sinasabing age-friendly environment. So what are these? What are the components of an age-friendly environment? So it consists of social support, protection against discrimination or yung ageism, protection against violence and abuse, continuing education and literacy programs, accessibility, hindi lang po sa walking ramps yan, accessibility din sa mga internet. Kagaya ngayon, ilan ba ang nakakapag-internet, nakakapag-webinar, no, na nakikinig sa atin? Enabling regulations for all these. So older people are encouraged to volunteer and mentor. So meron din po tayong gagampanan, tayong mga senior, mag-volunteer at mag-mentor because there are activities that you can do along with family members and friends, whether face-to-face or online, through your church, through your barangay. Okay? So mga LGUs natin, especially barangays, can support seniors who are also homebound, yung mga bedridden kunyari, by checking in on them daily, helping deliver food and medicines. And alam naman natin in our experience during the pandemic, yung sarili naming barangay, no, dito sa Quezon City, meron talagang mga napakagaling na volunteers, mga barangay workers, tanod, mga homeowners, no, na sila talaga ay tumulong sa pag-roll out ng COVID vaccination program natin. At nagde-deliver pa sila ng healthy food at saka mga PPE nung panahon ng COVID. So, ramdam na ramdam natin na kailangan talaga natin ng isa't isa nung COVID. So, isa po itong halimbawa ng age-friendly environment sapagkat hindi lang naman siguro sa COVID, pero kunyari, dito sa ating linya na pula, no? Kung hindi po tayo kasi magpapabakuna ay ang ating function, no? Ang ating function dahil nagkasakit na naman tayo ay lalalang mabilis. Pero dahil sa nagpabakuna tayo, dahil meron tayong functioning system of delivering vaccines, for example, at available ang vaccine, ang ating functional ability ay mapipreserve natin. Di po ba? So functioning is highest in youth and it steadily declines, as I said, no? And when COVID occurred and when we were able to introduce the vaccine, we were able to prevent COVID and hopefully also reduce the number of people who had long COVID. Diba? Long COVID kasi, natapos ka na dapat sa simptomas mo, pero hanggang ngayon, no, dahil nagka-COVID ka na malalang COVID, ikaw ay nangihina pa rin at makakalimutan pa rin. So the best barangays knew how many were their senior citizens. Kasi yun ang napaka-importanting nangyari. No? Dapat alam natin, kilala natin ang isa't isa. Okay. So, let us now go to research, no? Improving, measuring, monitoring, and research on healthy aging. Because we have to start with evidence, di ba? Kung hindi natin alam kung saan tayo nagsimula, paano natin malalaman kung saan tayo magtatapos? Di po ba? At paano natin gagawin ang ating mga programa? So ito na po ang aming Institute on Aging na nasa National Institutes of Health, University of the Philippines, Manila. At ang mission namin is to create and advocate with older persons unlimited possibilities for their value-added life through interdisciplinary transformative research, training, education, and specialized programs. And our vision is of the older person enjoying a healthy body, mind, and spirit, being treated with dignity and valued as a productive member of society in a dynamic process unique to oneself and beginning a life of unlimited possibilities. So, ilang taon nang nakalipas, noong 2015, no, pinondohan ng PCHRD at nag-research po kami, nasaan ba ang research natin tungkol sa aging? So, kinonsolidate po namin ito, ni-review namin yung mga online na mga na-publish na, bumisita po kami sa mga library at mga kinausap po namin yung mga professor sa iba't ibang dako ng Pilipinas, north to south, no? So ang napag-alaman po natin dito ay meron nga mga research, no? Dumadami na rin ang mga estudyante natin na gustong mag-research on aging. Kaya lang, hindi mahanap ang research nila. Sapagkat thesis, dissertation na andun lang sa library, no? Hindi po na-publish. And kung meron silang abstract, di ba? Yung parang summary ng result nila. Pati yung abstract hindi available at walang standard format. So, gulo-gulo po. Mabuti po ang ating mga library ngayon ay madami ng mga online at electronic database at maganda ang network ng mga libraries and librarians natin. So, very willing po sila na matulungan tayo na mahanap yan. So, meron na po tayo yung HERDIN na good database ng mga Philippine researches, no? So, nakita din namin, nagawa nga nila yung research nila, pero hindi naman maintindihan, no? Kasi halo-halo lahat ng age. Ngayon, hinalo nila ang conclusions nila, maging 60 man yan years old or maging 85 man sila. No? Hinalo-halo din nila kung maging female or male ba. Bilang mga researcher po sa geriatrics, alam po natin na iba't iba po ang ating experience sa pagtanda. Ang 60 to 70 years old po ay young pa, young old pa, mga malalakas pa. So ang kanilang mga sakit, mga nararamdaman, ibang-iba po sa mga nararamdaman ng mga 85 years and older. No? Sapagkat yung mga oldest old natin, yan ang kuminsan na nagkakaroon na ng tinatawag na frailty and disability and dependence on others. So ganun din po ang babae sa lalaki. Hindi po natin pwedeng pagsamahin lahat ng findings at sabihin ay pare-pareho lang ang tumatanda. Hindi po. Dapat po ay na-analyze po natin at hindi po yan nangyari sa halos lahat ng nakita naming research. So ngayon po, sinasabi po natin, let us do subgroup analysis to major age groups and also sub-analysis by gender. So ito po ang mga pinakamaraming region kung saan napakaraming research on aging. Pinakamarami po sa NCR, followed by Region 1 and Region 11. Siguro dahil sa napakaganda din ng mga university sa mga lugar na ito at marami ding mga tumatanda kasi dito sa lugar na ito. Okay? Ngayon, nag-meeting po kami noon pa with the DOH kasi gusto natin ding malaman yung strategic plan ng DOH tungkol sa healthy aging. Nag-meeting po kami tungkol sa measuring, monitoring, research. No? Isa lang po ito sa mga naging topic. Ito po yung mga kasama ko dun sa research monitoring strategic planning namin. 2016 pa po yun. No? Ito po ang napag-alaman namin. So madami pong gaps tayo. Service delivery, information, and human resource. Pero we will highlight itong mga malalaking mga font dito that we need a venue and funding for research dissemination, patent application, and policy recommendations. No? And we need to strengthen training programs on geriatric and gerontology research methods, as well as improve opportunities for the research staff. Minsan po kasi, ang nagre-research ay may ibang trabaho din. No? Sila din yung mga nurse at doktor sa ospital. So wala po silang extra incentive para magkaroon ng research. No? O gumawa ng research talaga. Okay? Ganon din po na pag nalaman po natin na ang OSCA po sa lahat po ng ating mga lugar na may OSCA ay dapat po sila po ang gumagawa ng listahan at nag-update ng listahan ng lahat ng mga senior citizens sa kanilang lugar. Nalaman po natin na hindi pala ito ginagampanan ng mabuti ng maraming OSCA sapagkat nung nagka-COVID na at babakunahan na sila, wala silang listahan. Konti lang po ang OSCA na napakahusay ang kanilang listahan. So we need to reiterate the function of the OSCA. Kasama din po yan sa research gaps. Yeah? Kasi dapat alam natin sino ba ang mga elderlies or senior citizens sa lugar natin. At doon po natin malalaman ano ba ang mga pangangailangan nila. No? Okay. So ngayon po, dahil napondohan po ng Department of Health at ng AHEAD program of research with the help of PCHRD, itong susunod na research program namin sa Institute on Aging, yung Fit for Frail, which is the focused interventions for frail older adults research and development program. Ito po ay isi-share ko yung ibang mga findings namin dyan. So, pinuntahan po namin ang 4 na barangay, NCR, Region 4, Cebu, and Davao. So, doon po namin inumpisahan, pero ngayon po ay nagro-roll out na po kami sa iba pang mga lugar. Region 1 and Region 3 po ang susunod. So, ang objectives po ng Fit for Frail ay maintindihan ano ba yung health systems natin tungkol sa healthy aging. And we wanted to see ano ba ang health status natin and what are the interdisciplinary, sociocultural, and medical solutions to help achieve active aging. As well as nag-capacity building na rin po kami kung paano ba gagawin yung mga assessment na yan. Para hindi lang kami ang gagawa, kundi pati yung mga interested na mga health research groups sa mga municipalities na napuntahan na natin. So, how did we measure intrinsic capacity? Tandaan po natin sa ating healthy aging framework, yung ating intrinsic capacity, yun po yung sarili nating kakayahan na tumanda, magkasakit, etc. Inintindi po namin mabuti by doing the comprehensive geriatric assessment. Okay. Ito po ay validated at piloted tool na ginawa po namin with the VOA, with the Philippine College of Geriatric. Ito na po ay Ingles, Filipino at Bisaya. So kasama po doon yung usual, very simple, vital signs, height and weight, laboratory test, tapos meron pa po kaming mga tanong tungkol sa kanilang quality of life, memory test, nutrition, tapos sinukat din namin yung mga risk of falling nila, no? Kasama na din po yung grip strength and muscle strength. So ito po yung comprehensive geriatric assessment. Naalala ko po dito sa ating interview, no? Sabi nung isang senior citizen, sana magkaroon ng comprehensive program ang gobyerno natin para sa matanda. I think it has to start with a comprehensive geriatric assessment, no? Nagawa na po namin ito sa UP Diliman. Nahalata ko na marami sa mga in-interview kanina taga Diliman eh. So marami po siguro sa inyo sa Diliman ay nag-participate dito sa Fit for Frail at saka ang isa pa po yung UP Wise Diliman. Ganito rin po, CGA or Comprehensive Geriatric Assessment din ang ginawa natin at marami silang naitulong sa kaalaman. So ano ba ang kaalaman natin sa Fit for Frail? Yan, sabi natin ang lifestyle ay napaka-importante sa healthy aging. No? So dun sa ating barangay na mga pinuntahan sa Fit for Frail, nasabi, ang napag-alaman natin ay more than half never smoke. So mabuti naman pala. Pero meron din naman mga past smokers, no? At sa mga past smokers, sila po ay kadalasang mga lalaki na nagkakaedad na 80 and older. So siguro nung araw talaga napakaraming mga lalaki na ngayon ay tumanda na naninigarilyo. Pero sa current smoker naman, lalaki din na age 60 to 69. So yun po. Pero at least 58.5% ay never nagsigarilyo. Sa alak naman, more than half ever drank alcohol. So sa buong buhay nila, 57.3% ay nakainom na ng alak. No? For past and current drinkers, again, mostly male, 60 to 69. Ngayon, dito lang sa alak at saka paninigarilyo, parang maintindihan na natin bakit pa mas maiksi ang life expectancy ng mga lalaki kumpara sa mga babae. At isa sa mga iniisip natin talaga ay siguro dahil sa napakaraming lalaki ang hanggang ngayon ay naninigarilyo pa at malakas inom ng alak. Ngayon, dito naman sa illicit drugs, 97.3% ay never took any kind of illicit drugs. Kung meron man, ang sumang-ayon na nakasubok na sila ng bawal na gamot, mga lalaki na naman na 60 to 69. Sa pag-inom naman ng kape at saka tsaa, halos lahat po, 94.4%, babae man o lalaki ay umiinom ng kape at mga 69.2% ang umiinom ng tsaa. Okay. So, tinignan po sila ng mga geriatrician, hindi po ba? Ang mga geriatrician po ay sinanay namin dito sa research na ito at meron po silang kaalaman tungkol sa comprehensive geriatric assessment. So tinanong po natin yung ating mga participant, ano ba ang pagkakaalam nyo na naging sakit ninyo nung kayo ay nagpa-check up? So yun po yung blue, no? Makikita po natin yung blue, yung self-reported diagnosis. Yung pula naman, yung geriatrician diagnosis nung kami ay gumawa ng Fit for Frail. So ang napag-alaman po natin, may pagkakaiba po, hindi ba? Mas marami po kaming na-pick up na presbyopia or sakit ng mata ng pagtanda, yung mga doble vista. So marami ang hindi alam, ako, kailangan ko na pala ng doble vista. Konti lang naman ang kaibahan pagdating sa high blood. So maganda po ang general screening natin for hypertension. Arthritis. Naku, marami palang hindi alam na may arthritis na sila. No? Maganda naman pagdating sa diabetes. excuse me, pagdating sa katarata, maraming nag-akala na may katarata sila, hindi naman po. So yun po. Excuse me. Mas malaki po ang pagkakaiba pagdating sa mental health. No? Sapagkat marami po ang nag-isip, ito po yung dilaw, yung self-reported, na simptomas. Simptomas po. Yung pula, yung nag-diagnose sa kanila, halos wala halos wala. At geriatrician diagnosis, yung blue. So marami pong nag-akala na sila ay may dementia na kasi sabi na, may symptom na ako ng dementia. Pero nung tinignan na sila ng mga doktor natin, 9.1% na po. Marami pong nag-experience ng anxiety. Ito po ay wala pang COVID 25.9% po ang may anxiety sa mga seniors na nakita namin. And 7.7% of them were diagnosed by our geriatricians to really have anxiety. Pagdating sa Alzheimer's, wala pong nagsabi na may Alzheimer's sila. 0.7 lang po ang nagsabi na talagang na-diagnose ng may Alzheimer's. Pero nung tinignan na po namin, 3.2% doon ay talagang may Alzheimer's pala. So pagdating sa mental health and memory, malaki po ang pagkakaiba. Ganon din po sa syndrome. Ang syndrome po ay kadalasan ay naiisip natin ay para sa mga tumatanda lang, gaya ng madaling madapa, hindi makatulog, depression, dementia, hindi mapigilan ng ihi, napakarami ng iniinom na gamot, no? Osteoporosis, poor balance, deconditioning. Pag-alaman namin na mas marami kaming na-pick up ng mga syndromes, no? Nung ginawa namin ng comprehensive geriatric assessment. Ngayon dun sa mga syndrome, halos lahat pareho, whatever sex, no? Between sexes, except for depression and dementia. Sapagkat ang depression and dementia po ay mas mataas sa mga babae, no? Sa mga babae na nakita na. So anxiety, depression, dementia, pero ang depression mas madami sa babae. Sa katatapos lang po namin ang UP Manila WISE, no? Sa UP Manila, mas marami pong lalaki ang may anxiety. Okay? So, nandito na po tayo sa improving healthy aging through policy generation. So, bukod po sa Department of Health, kausap din po natin ang National Commission of Senior Citizens. No? Medyo bago-bago pa lang po ang NCSC, pero very eager po sila to hear about what we think are the policies that are needed. So, lahat po ng ito ay galing sa Fit for Frail na pag-aaral natin at isa sa mga polisiya po na gusto sana namin na magampanan ay to strengthen the National Geriatric Health Program for Filipinos in the decade of healthy aging. So kasama po doon ang yung programa na ibibigay, kung ano ba yung mga package, no, na healthy package, healthy aging package. Pero ganun din ang pag-improve ng mga facilities natin sa mga ospital ng DOH, kunyari sa mga primary care centers. At saka syempre na magkaroon naman ng madaming health providers na na-training sa geriatrics and gerontology. Okay. Okay. Isa pa ay yung pagbabakuna sapagkat napakakonti lang po ang nagpapabakuna laban sa flu at saka lalong-lalo na sa pneumonia, no? So gusto po sana namin na magkaroon ng mas mabuting vaccination program. So pagdating din naman sa fall prevention, kasi medyo marami-rami yung ating nakitang fallers and at risk for falling, no, more than 30%. Gusto po sana na unang-una yung mata, dapat magkaroon tayo talaga ng visual health program and screening sapagkat kung malabo ang mata mo, madali kang madapa. Pero ganun din yung lakas ng katawan, no? Yung pag-ehersisyo, magkaroon ng exercise program tayo sa ating mga komunidad para hindi tayo madaling mahulog at maging parang magkaroon tayo ng frailty. No? Napag-alaman namin kasi marunong naman at madami naman tayong pagkakataon upang maglakad. Pero yung weightlifting, yung weight training para magkaroon ng muscle sa binte at saka dito sa likod at sa braso, importante po yun. Yun po ang kakulangan sa exercise program ng mga senior. Pagdating naman po sa mental health, we shared our findings as well based on health systems reviews. Napakakonti pala. We only had 37 psychologists can be found in all 27 hospitals that are government, yung mga big hospitals that are government. 37 of the 37 hospitals, no, that are under the DOH, and these are big hospitals in regions, 37 lang po ang ating psychologist, no? So napakakonti. At kung meron man, hindi naman na-train sa pag-alaga sa senior citizen. So kailangan po ng more training especially. Alright, so dito naman po tayo sa capacity building. Gaya ng sabi ko, meron man tayong building para sa senior citizen, meron man tayong ward kung wala namang na-train na mga doktor, nurse, PT, OT, pharmacist, ay sayang lang naman lahat ng infrastructure na yan. So ito pong capacity building ay since 1998, umiikot na po kami dito sa Maynila, ganun din sa buong parte ng Pilipinas. Ang una po namin pinuntahan ay sa Palo, Leyte, no? School for Health Sciences. 2010 pa lang po na andun na kami sa Palo. At syempre, yung ating mga undergraduate medical students, yung mga kasama natin sa DOH, Philippine College of Geriatric Medicine, madami po na tayong mga naging training. Hindi lang po training ng end users and workers, kundi training of trainers. Training of trainers para sila na rin po ay marunong magturo sa kanilang mga health workers kung paano ba mag-asikaso ng senior citizens. Okay? So sa Kolehiyo ng Medisina po, meron na po rin tayo. Meron po tayong isang administrative order, no? So ito po call for mandatory inclusion of geriatric competencies in the training of health and care professionals. Yung CHED po, meron na po since 2017 na administrative order na dapat ang mga medical schools ay may geriatrics na sa kanilang curriculum. Unfortunately, napag-alaman ko na hindi lahat ng medical schools ay nagtuturo ng geriatrics or gerontology. Kulang na kulang pa rin po. Ang nursing, mas maganda po ang nursing. Ang nursing talagang maganda na po. Halos lahat na ng mga eskwelahan ng nursing ay meron ng kurso sa geriatric care. No? So let's continue geriatric research naman, how to do research. So may pondo naman po tayo galing sa Fit for Frail at saka tulong ng DOH. So madami na po tayong na-train sa iba't ibang region. Pero kulang pa po. Kulang pa po ang training natin. Mga workshops po yan. Pati FNRI po, yung Food and Nutrition Research Institute, ay may research na rin ngayon tungkol sa older population. At tinraining po namin sila how to do the CGA for research. Okay, ngayon meron po tayong available sa ating webpage, Healthy Aging. It is free, it's available online. Healthy Aging or Malusog na Pagtanda, ito po ay pinondohan ng World Health Organization. No? At makikita po niyo dyan ang aming mga free resources, especially on healthy aging and dementia. And of course, meron na po ang Department of Health ng training program for primary care health workers. Paano ba magkaroon ng programa ng serbisyo ang DOH, primary health service providers. No? Kasi kasama na po sa universal healthcare. Ayan, ang ginagawa nila. Ngayon, dito sa Philippine College of Physicians, kaka-launch lang po. Ang PCP po ay mga specialista po kami lahat sa internal medicine. Ay, nagpapasalamat po ako kay Dean Mejia na meron po kami ngayong chapter 10 dun sa bagong textbook na yan, chapter 10 on geriatric medicine. So ayan po si Dr. Mejia at saka si Doc Abad. So masayang-masaya po kami lahat dyan. Okay, service. Siyempre, importante po ang service. PGH po ang kauna-unahang Department of Outpatient na nagkaroon ng geriatric clinic. No? At pinaganda po ito ng People of Japan noong 2005, parang ganun po yata. So meron po tayong mga serbisyo dyan para sa ating mga katatanda. So balikan lang po natin bago ako magtapos. Kailangan po, every country has to have a healthy aging commitment to action. No? And we need to continue to develop age-friendly environments, align our health systems to the needs of older population, and continue researches on aging. We are now we are now doing research on long-term care. Is it affordable? What kind of long-term care do we need? Is are Filipinos ready for long-term care? So nandun na po tayo ngayon. So salamat po sa mga partners ng Institute on Aging NIH, TVUP, the whole of the UP system. No? Salamat po ng marami. Pati lalong-lalo na po sa mga senior citizen na nag-participate sa mga researches po namin. So ano ba ang ating tungkulin? Ayan din po. No? Iniba ko lang ng konti ang pagpatype. Pero ang importante po, tayo po mga senior citizen, dapat po mag-participate po sa research. Kasi kung hindi po kayo mag-participate sa research, hindi po natin malalaman ano ba ang kailangan ng senior citizen. So please, be there when we call for participation. Salamat po. Ito po yung ating mga Facebook at saka yung Healthy Aging webpage. Madami pong mga libre dyan, pati pong mga YouTube webinars libre. Salamat po ng marami.
All right, thank you so much, Director Sherry De La Vega. You'd see may mga ano po, no, may mga comments na po and their reactions. And thank you so much for that very interesting. Marami po natutunan, especially in the work that you've done and the research that you've done all the way back in 2010 pa po for the Institute on Aging.
Salamat,
Okay,
Sarmiento.
yes, thank you, ma'am. Before we proceed po, we'd like to get everyone and encourage everyone po to put in your questions in the Q&A box. And if you are watching this outside of the Zoom, maybe in YouTube or in Facebook, please put them in the comment section. And hopefully we'll be able to pick out your questions po from mga nagtatanong po sa ating mga speakers. Okay? Up next is our reactor, practicing geriatric medicine specialist din po, as mentioned by Director Shelly. He is on the board po of the Philippine College for Geriatric Medicine. Please welcome Dr. Mark Evans Abat.
Thank you, Dr. Raymond, for inviting me over for this webinar, and congratulations, Dr. De La Vega, for the comprehensive lecture. So we would see that part of Dr. De La Vega's lecture is the emphasis on the role of a healthy environment to promote healthy aging. So very important yung konsepto na yun of having a healthy environment to promote healthy aging. As we can see, and if you are aware, there is a document published several years ago regarding the roles of several risk factors for dementia, for example. And that's from the Lancet Commission. And part of that document is the role or the risk of having dementia because of pollution, for example. Okay, so pollution was identified as a risk factor for dementia, and that in itself is a reflection of the need for having a safe environment to have a healthy aging. So that's one. Okay, the second, of course, is having, as was emphasized earlier, having safe spaces available for our older persons to do a lot of activities. Okay, so makikita natin sa daan natin dito sa Manila, for example, there are very limited spaces that the older person can do any activity. Ang hirap maglakad sa sidewalk, maraming obstructions. The sidewalk itself can be unsafe and uneven and can cause falling. Okay, and there are few parks or recreational areas wherein they can do exercises and breathe fresh air. Okay, so that's one thing that has to be addressed by our administrators or our government. The problem lang with that is a lot of experts in urban planning itself have really acknowledged that our city, for example, really has a bad urban planning concept even in the middle of this century or the previous century. So it's a big challenge to renovate that. Okay. And then, of course, Dr. De La Vega emphasized the COVID response. addressed towards the elderly, particularly the provision of vaccination, especially during the pandemic, ano? So a lot of groups worldwide actually have noted the difficulties and challenges for providing activities to our older patients during that time. And those challenges actually persisted even as the pandemic started to decline, ano? Uh, but there are also improvements already. Older persons are already getting out, able to enjoy socialization ulit, but there is a relative lack of organized activities that they can enjoy and that can help facilitate yung healthy aging. Okay. Another thing that was emphasized is the system that can provide or address or monitor the health status of older patients. Okay. That system can be available for the relatively affluent older persons kasi they have access to larger health institutions, they can go frequently to their doctors for a checkup. But what about those who are not so privileged? Ba? There has to be a way for the health of the older person at those levels to be monitored and to all the problems be addressed properly and earlier on. Okay. So there has to be a system, and part of that would be probably training grassroots health providers, especially our barangay health workers. Um, a colleague had started a primary care initiative studying a revision of a primary care model in Bataan. Okay, so that in itself involved training our barangay health workers in identifying diseases earlier on so that they're able to give uh, first aid or preliminary management, and they're able to identify those problems so that they can bring the patient to a healthcare provider as soon as possible. So that has to be expanded to include geriatric principles and geriatric care. Okay. So one common problem or challenge, I won't say problem, but challenge in all of these aspects of care is health financing, of course. It would really be difficult to implement a lot of these changes if there is no system to finance these activities. So research, actual provision of care for the older persons would be challenging if the person who is to provide those activities will not receive remuneration. And PhilHealth probably has a lot of roles in this aspect. Like for example, home visits by doctors. It would probably encouraging for doctors to do house calls if PhilHealth is able to compensate them for that effort, especially for our not so privileged older patients. Okay. And then, of course, there's a challenge in changing the mindset of medical care for older patients. Okay, and that was emphasized by Dr. De La Vega earlier on. You have to be able to address the care models being received by older patients, shifting from purely disease-based or specialty-based care to a more holistic care of the older patient to provide especially healthy aging, not just curing or controlling diseases. Okay? And it was also emphasized kanina that maybe emergency responses that were being given during the height of the COVID pandemic start to be shifted to a more long-term and sustainable response for the older individual, like, of course, improving vaccination access and vaccination continuity for our older patients. Okay. Research challenge was highlighted by Dr. De La Vega, and a bulk of the challenge with older patients, of course, being involved in research is one, the mindset that baka masyadong napapakinabangan or na-abuse ang involvement ng older patients among research. So that mindset should be corrected. It should be emphasized that the contribution of the older patient in expanding medical knowledge or knowledge in geriatric care is very important. Okay, and it should be justly remunerated. Okay. I'm glad Dr. De La Vega mentioned OSCA kanina, and it's true. There are a lot of things in government that have a lot of overlap and has a lot of ambiguity. Like, for example, is the role of OSCA just collating the list of senior citizens? Okay, I think OSCA should play a bigger role and a more active role in promoting the health and well-being of older patients because they're the ones liaisoning directly for the older patient and government. So their role has to be expanded or has to be more clearly defined. Okay? And then, of course, Dr. De La Vega talk about capacity building. Ano? It's very important that people who are familiar with providing care for the older patient be expanded. So that's being addressed. There are a lot more hospitals right now training doctors in geriatric medicine fellowship. When I was in training, only St. Luke's Quezon City had fellowship program. Right now, there are, I think, 9 or 8 hospitals that are now providing geriatric medicine fellowship training, and some of them are in the provinces already. So hopefully, in the next 3 to 5 years, the number of training institutions that will provide geriatric medicine fellowship will also expand. And this should address the availability of personnel to man the DOH hospitals who are identified as centers for excellence for geriatric care. So hopefully in the next 3 to 5 years, that would improve the number of personnel. Corollary to that, we should also optimize the training of the nurses and other allied health professionals in geriatric care. Doctora really mentioned that, yeah, the nurses actually have a better curriculum that reflects geriatric care compared to medical medical school, ano? A lot of the nurses or almost all nursing colleges have already incorporated geriatrics and gerontology in their curriculum. And in fact, I had a recent talk with a, a fourth year batch of nursing students in Quezon City. Part of their curriculum really involves having those exposure, those rotations in nursing homes and in the hospital involved in nursing care. Okay. And then finally, as I mentioned earlier, we really have to bring access to medical care at the grassroots, at the barangay level. So we have to be able to provide considerable training for our barangay health workers or any personnel at the barangay level that are engaged in the health and well-being of the older patients. So this has to be addressed, and I think a lot of institutions will start to get involved in this. Like for example, in the medical city where I'm heading the section of geriatric medicine, we will be starting in stages several research initiatives towards addressing the mental health and well-being of the older patients at the barangay level. So that will be started. I do hope more institutions will try to address the need for having grassroots healthcare providers to address the needs of the older patient. Now, overall, Dr. De La Vega, as usual, presented to us a very comprehensive discussion on healthy aging, the World Health Organization framework for healthy aging is an excellent framework and addresses not just the intrinsic problems of the older patient, but also external factors that will affect the health of the older patient. And it's really good that research is in progress and is being done continuously to generate data or information uh, that will help in the care of the older patient. So again, Dr. De La Vega, congratulations, and to TVUP, congratulations for having this webinar this afternoon. Thank you for having us.
All right, thank you so much, Dr. Abat. Marami po tayong na pick up din doon sa reaction ni Dr. Abat. Maraming salamat po. And those may mga questions, I think Dr. Shelly is trying to answer some of them there, and we'll go ahead with our Q&A. Well, some of them have been answered already by Dr. Shelly. I think there's another question. The last question from Dr. Joseph Tortona. Ma'am Shelly, if you can answer this. Can LGUs do house-to-house vaccinations for senior
Oo,
citizens? And
dapat.
at the yun nga, ma'am, eh. And at the same time, can they give out supplements and then on self-care and then handbooks on self-care and then mental health daw po?
Okay. Malaki ang tungkulin na gagampanan talaga ng mga LGU. But ang bawat barangay merong senior citizen coordinator eh. Alam ba ninyo?
Mm.
So depende sa galing talaga, no? And usually there's a committee there and active homeowners that also help, no? Yes, vaccination, especially if the senior citizen has a disability. Kunyari, mahirap na talaga siyang umakyat sa hagdanan or kailangan ng wheelchair or bedridden, dapat naman dalawin at doon bigyan ng bakuna. So, nangyari naman yan sa maraming lugar sa Pilipinas nung nagka-COVID, di ba? Tungkol naman sa mga supplements at saka yung mga pamphlets, mag-ingat lang na hindi siya promotion ng isang kumpanya lang, di ba? Minsan kasi nagagamit tayo eh. Merong nagpo-promote ng mga kung ano-ano na hindi naman siya scientific, hindi naman siya aprobado ng FDA, pinamimigay at tinatanggap namin dahil lang sa libre. So mag-ingat din naman tayo. Kailangan meron tayong proseso kung saan natin masasabi na, maganda yan. Maganda yan ipamigay. Siguro dapat ligtas, no? Hindi rin naman maganda yung kung ano-ano. Di ba?
That's true.
Legitimate sana. Thank you.
Thank you, Director Shelly. Dr. Dion, any questions on your end, ma'am?
Meron po akong nakuha dito, siguro relevant din po siya. Kasi when we heard the presentation and even from the reaction of Dr. Abat, obvious naman ho na marami hong mga activities no around the country, all over different fronts no na nagpo-pursue ng promotion of healthy aging. Meron sa akademya, meron sa mga ospital, meron sa mga barangay. Pero kung iisipin po natin, at meron din mga programa ang gobyerno, no? Pero ang tanong sino ang nagsusulong ng mga ito? Paano natin siya maging isang concerted na effort para hindi swertihan kung nasa barangay tayo na magaling ang mga senior citizen workers natin or nandun tayo sa private institution at dun tayo nagpapatingin para makuha natin yung dapat na serbisyo na nakukuha ng mga elderly. Siguro any of our speakers can probably give their opinion on sino ba talaga ang dapat magsulong nito para sa whether you're in the Metro Manila or you're in a far-flung area ay naibibigay natin ano yung dapat na maibigay na serbisyo para sa ating mga senior citizens.
Ikaw, Dr. Abat, naisip ko yung omnibus yung omnibus guideline at saka yung kung ano man yung sana bayaran din ng PhilHealth kasi dumaan na yan sa proseso. Kung kunyari ang serbisyo, ang gamot, no, ay inaprubahan ng PhilHealth at nasa omnibus guideline, yun ang maganda. Kasi sila ang may monitoring power Diba? Sila ang monitoring and implementing power. Pagdating naman sa mga doktor, no? Meron din naman tayong tinatawag na clinical practice guideline. Sa ating mga doktor na under the Philippine College of Physicians or PAFP, for example, and other specialty organizations, meron tayong tamang proseso na dapat sundan sa iba't ibang uri ng sakit. So yung clinical practice guideline makakatulong para maging tama ang lahat ng proseso ng pag-aalaga at pagbibigay ng serbisyo. Pero yung mga ibang services, meron naman National Commission on Senior Citizens. Okay. The National Commission on Senior Citizens, bago lang po yan. Bago lang sila. Konti pa lang ang budget nila. But they now are working with various LGUs to improve community-based services. Hindi ko lang po alam kung meron silang parang ombudsman. Kasi sa ibang bansa, meron mga ombudsman na tumitingin ng kalidad ng serbisyo Maaring siguro yun ang ating kailangan. Ayan, may tinype si Doc Sarmiento na consulta package. So yan yung parang universal healthcare, primary care package natin. Doc Abat, anong madadagdag pa natin?
Well, of course, when you talk about government, you can always give a lot of guidelines, can always give a lot of policy, but the third is in the implementation palagi, di ba? It's always that. You can always put down a lot of those policy framework, but if no one imposes that it should be implemented, it will not happen. And sometimes the implementation is affected also by a lot of other factors. It's really hard for the level of services being provided by Makati LGU, for example, to be provided at the same level by LGUs, let's say in Tawi-Tawi or in the very flank Gida areas, di ba? That's very difficult. And we have to recognize that there may be some level of inequities. The thing is, how do we address those inequities in delivery of provision of care, di ba? Again, there's a lot of challenge and a lot of that also involves not just money, but also the amount of personnel and the drive of the local administrators themselves, di ba? So it's really a challenging factor, but it should always start with how government higher ups impose the implementation of these policies ano down the line. Okay?
Oo. Tama. Alam mo, Doc Abat at saka Doc Sakdalan, devolved kasi tayo di ba? Ang nag-implement hindi ang DOH. Ang DOH provides policy guidance, etc. Ang pinaka-importante, I think, yung mga senior citizens. Dapat tayo ang mag-advocate sa sarili nating pangangailangan. At kung boboto man kayo, sorry, I don't want to enter into that. Pero pumili kayo ng magandang leader sa lugar ninyo na alam ninyo na makakatulong sa inyong mga programa. Pero be active. Be active in your own senior citizen groups, whether it's an organized group or just basta maging aktibo kayo. Ganon.
Marami pong salamat. And I think importante yung sinabi ni na Dr. De La Vega and Dr. Apat, no? We really can't wait for government to, do a better job in providing all these services. Kailangan magsimula talaga sa atin and kailangan yung awareness natin. Ano yung pwede natin gawin within ourselves, our family, our community para masulong natin yung healthy aging. Dr. Raymond?
Thank you. Thank you again to Director Shelley and Dr. Mark for their insights. So we'll try to wrap up, but before that, we will be launching our evaluation poll. Ito pong evaluation poll, we don't have anything that's outside of this. We encourage everyone to put in your inputs po and try to provide feedback, especially not just on the topic but on our speakers po. So I'll read the 5 questions. It's a 4-point Likert scale, and then we'll move on to our topics for next week. So number 1, the panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. So we will not be closing this until the end of the webinar. Next week po, we'll have another exciting topic. Ano po ba yun, Dr. Dion?
Oy, alam ko na, Doc Raymond. So for next week, our topic is on updates on diabetes medications, and we've invited a good presenter on this, a specialist in endocrinology, and we look forward to that presentation and to our reactor for next week. So magkita-kita po tayo ulit.
Okay, thank you so much. For those who are asking, especially I saw in the chat po, no, we archive all of our episodes po in the YouTube channel of TVUP. So if you go to youtube.com/TVUPPH, and then in the live tab, you'll be able to watch po our webinar 180, which is today, and all of our previous 179 webinars. Also, we have snippets po, what we call YouTube Shorts. So you can watch them at your convenience, selected presentations po in snippets, and you can also find them in youtube.com/TVUPPH. So this formally closes our webinar for the week. We look forward again to your company next Friday from 12 noon to 1 p.m. It's a date.
Together, we can stop preventable deaths.
So keep safe, keep healthy, and see you online.
Thank you, everyone.